This research is about microRNAs and risk factors for diabetic nephropathy in Egyptian children and adolescents with type 1 diabetes. Diabetic nephropathy is one of the most serious and prevalent complications in diabetic patients, leading to end-stage renal disease with high mortality and morbidity. Albuminuria has been one of the standard methods of screening of renal affection, but it has many limitations. MicroRNAs can influence the expression of gene regulation and may contribute in the development and pathogenesis of diabetic nephropathy. However, research evidence is insufficient and most studies were done in type 2 diabetes. The aim of this work was to study the expression of microRNAs 377, 93, 216A, 21 and 25 in a sample of type 1 diabetic children and adolescents and explore the association of microRNAs with risk factors and other indices of diabetic nephropathy and markers of acute kidney injury. It was a cross-sectional study done on 70 children and adolescents with type 1 diabetes who were recruited from the Diabetes, Endocrine and Metabolism Pediatric Unit, Children's Hospital, Cairo University. It was ethically approved by Cairo University. Demographic data: anthropometry, blood pressure, hemoglobin A1C, fasting lipid profile, serum creatinine, urinary cystatin C, albumin creatinine ratio, and estimated glomerular filtration rate was calculated both by using creatinine and urinary cystatin C. Molecular studies was done using real-time PCR, and microRNA 16 was used as a reference gene, and the equation 2 to the power minus delta delta CT was used to calculate the microRNA expression fold change. Patients were classified into two groups, a group with diabetic nephropathy and a group without diabetic nephropathy, according to the levels of the ACR according to the guidelines. And these were the results: hemoglobin A1C and urinary cystatin C and estimated glomerular filtration rate by cystatin C as well as ACR values were higher in the groups with diabetic nephropathy than in the groups without diabetic nephropathy, and these comparisons were statistically significant. MicroRNA 93 and 377 were significantly upregulated in the group with diabetic nephropathy, while the microRNA 25 was significantly downregulated in the group with diabetic nephropathy. When taking all the cases and studying the significant correlations, we found that the microRNA 93 was significantly correlated with hemoglobin A1C and with ACR. MicroRNA 377 was positively correlated to LDL, while microRNA 25 was negatively correlated to ACR. And when studying the group with diabetic nephropathy, microRNA 216A was negatively correlated with serum creatinine and positively correlated with estimated glomerular filtration rate using creatinine, while the microRNA 21 was positively correlated with the levels of urinary cystatin C and negatively correlated with the estimated glomerular filtration rate using cystatin C. So the conclusion was that we found that microRNA 377 and 93 were upregulated in the group with diabetic nephropathy. MicroRNA 25 was significantly downregulated in the same group. MicroRNA 93 showed increased risk for albuminuria, while microRNA 25 showed decreased risk for anemia. So we concluded that microRNA 216A, 21, 377, and 93 may be associated with diabetic nephropathy pathogenesis, while the microRNA 25 may have a renal role. Further studies are needed to deepen our understanding of the pathogenesis of diabetic nephropathy and the possible diagnostic, prognostic, and therapeutic roles of microRNAs in diabetes-related renal injury. Therapeutic targeting of microRNAs by exploration of new techniques to upregulate the renoprotective microRNAs or downregulate the harmful microRNAs in order to prevent and halt progression of diabetic nephropathy.